Hey, it's your family doctor. Thanks for being here. Have you ever thought about this? That little morning routine, the one where you carefully take your pills because you're trying to do the right thing for your health. What if that very habit is quietly doing something you never knew about? Let me tell you about someone. She was a 68-year-old retired teacher, healthy, active every morning at 5:30 in the morning. Shed, get up, go to the park, do her Tai Chi, come home, make breakfast for her grandkids. She also took her medications like clockwork, a heart medication, a statin for cholesterol, a stomach pill. She trusted her doctor. She never missed a dose. And then one ordinary Tuesday morning, she was washing dishes in the kitchen and she just collapsed. It wasn't a sudden heart attack. It wasn't a stroke. It was the combination of medications she'd been taking for 4 years, medications she thought were saving her life that quietly worked together in a way no one noticed. I've been a board certified family physician for over 10 years, and I've seen too many of these moments, moments that didn't have to happen today. I want to tell you something I rarely have time to say fully in a 15-minute appointment. It's about 5 medications. Almost every person over 60 is taking at least one of them, and each one by itself looks harmless. But when you put them together, that can be a completely different story. If you have aging parents, a partner, or you're taking medications yourself, please stay with me because that woman didn't need to leave that early. And the information that could change everything, it starts with the very first medication. Number one, statins. Have you heard the word statin, atorvastatin, rosuvastatin? Simvastatin, those names might sound new, but if I say cholesterol medication, you know exactly what I mean. Based on what I see in my practice every single day, out of 3 people over 60, nearly 2 are on a statin. Their doctor said their cholesterol was high and they need to control it, so they take it for years. That retired teacher I mentioned. She was one of them. Her cholesterol numbers were a little high. Her primary doctor said this medication will protect your heart, and she believed him because that was her lifetime habit, trusting the expert, following the rules. But here's the thing her doctor didn't tell her. Statins work by blocking an enzyme in your liver called HMG-CoA reductase. That lowers your cholesterol. Sounds good, right? The problem is that same enzyme is also responsible for making something else. Cuctin, coenzyme Q10, you may not know that name, but your heart depends on it every single second. Coctin is the fuel for your heart muscle cells. Think of it as your heart's battery. Without it, your heart can still beat, but with less and less power, like a phone battery slowly dropping 1% at a time. After age 60, your natural coctin levels are already much lower than when you were younger, and statins push them down even further. Some research shows that long-term statin use can lower coctin levels by 30 to 40%. And here's what's tricky, that drop doesn't make you collapse overnight. It happens slowly, quietly, like a candle that nobody blows out, but it just burns down. About 18 months after that woman started her statin, she began saying she was always tired. Her daughter thought it was just aging. She thought so too, but that wasn't aging. That was her heart using the only way it had left to tell her, I'm struggling. And there's something else many people don't know. In certain people, long-term statin use noticeably increases the risk of developing type 2 diabetes. Especially in women after menopause and men over 65, she developed unexplained high blood sugar about a year and 8 months after starting her statin. So her doctor prescribed metformin, and nobody, not one doctor, went back and asked, could the cholesterol medication have led to this? Now, let me be very clear. I am not telling you to stop your statin tonight. Say it with me, do not suddenly stop a statin. Stopping abruptly can cause a rebound effect that leads to serious artery inflammation that can be even more dangerous. But I want you to remember a few things. First, if you're on a statin, ask your doctor this exact question. Do I need to take Coctin along with it? That one question can change a lot. Second, many of my patients find that taking around 400 milligrams of Coctin a day helps support normal heart function and reduce muscle aches. Third, look at your diet quality: olive oil, fatty fish like salmon and sardines, walnuts, flax seeds. These healthy fats are the raw materials your body uses to make cholesterol in a balanced way. We want to help your body find its own balance, not just hammer it down with a medication. I had a patient, I'll call him Mr. Jong, but that's not his real name, 71 years old. He came to see me with muscle pain all over his body. He couldn't sleep at night. He thought it was arthritis. Then I looked at his medication list. High-dose statin, 2.5 years. I explained how statins can lower coctin and cause muscle symptoms. We adjusted his dose slowly. With his primary doctor's help and added Coctin, 3 months later, he called me. He said, "Doctor, I slept through the night. I haven't slept like this in 2 years." That small thing, that was huge for him. So that's the first medication, but I'm not done because the second medication, it's in almost every home in America. You probably have it in your bathroom cabinet right now. Number two, anti-inflammatories like ibuprofen. Think about this. Last time you had a headache, what did you take? Your back hurt, knee acted up. What's the first thing you reach for? Ibuprofen, naproxen, Advil, Aleve. You don't need a prescription. You can pick them up at Walmart, CVS, any grocery store. They're cheap, they work fast, and they feel as harmless as popping a piece of candy. Here's what happened to that same patient. She had arthritis in her knee. Her orthopedist said you can take ibuprofen long term. It's very gentle, don't worry. So she took 600 milligrams 3 times a day. Her cardiologist didn't know, her primary care doctor didn't know. Each doctor saw only their own piece of the puzzle. Nobody put everything together into one complete picture. And that right there is a crack in modern medicine that we don't talk about enough. So let me explain how these medications work. Non-steroidal anti-inflammatory drugs. NSAIDs block two enzymes called COX-1 and COX-2. COX-2 causes inflammation, block it, and your pain gets better. But COX-1 does something really important. It protects your stomach lining and maintains the natural protective layer inside your blood vessels. When you block COX-1, that protection disappears, your blood vessel walls become more fragile, your blood pressure starts to creep up, your kidneys hold on to extra sodium and water, and your heart has to work harder. Day after day, for someone over 65 whose kidney function is already about half of what it was at age 30, this burden hits even faster and harder. One study showed that in people over 65, taking ibuprofen for just 7 days noticeably increased the risk of a heart attack. 7 days, not 7 years, 7 days. And she took it for nearly 4 years. I will never forget one night in the hospital. This was years ago. A 66-year-old man came in with massive gastrointestinal bleeding. We thought it was a tumor. We were getting ready for a big workup. Then we sat down and really asked, "What medications are you taking?" He said, "Oh, just ibuprofen for my shoulder pain." I've been buying it over the counter for about 6 months. No one told me not to. That night, I sat there thinking how many people across the country are quietly, unknowingly, slowly damaging their stomach and their heart with a harmless painkiller. Now, here's the good news. There are other options. Curcumin, that's the active part of turmeric. Some research suggests that in certain ways its anti-inflammatory effect can be comparable to ibuprofen, but without the same risk to your heart. Many of my patients take around 500 milligrams twice a day, and they add a little black pepper extract to help absorption, high-quality fish oil, EPA and DHA. Acts like a natural anti-inflammatory that actually protects your heart instead of attacking it. And don't forget simple physical approaches, hot and cold packs, acupuncture, gentle low-impact exercise. These aren't alternative, they are just good medicine. Sometimes they work better than a pill, and they get to the root of the problem. Because pain is your body talking to you. It's telling you something needs attention. Masking it is not the same as fixing it. So next time you reach for that bottle of ibuprofen, I want you to pause for 1 second. Just 1 second and ask yourself, is there another way? Number three, stomach protectors. This one might surprise you. It's probably the last thing you'd expect. The logic sounds perfect, right? I'm taking an anti-inflammatory for my arthritis and it might bother my stomach, so I'll add a stomach protector. Problem solved. Hospitals do this every single day. Millions of Americans take a proton pump inhibitor or PPI like omeprazole, esomeprazole, lansoprazole, them as Prilosec, Nexium, Prevacid, and sure enough, she was given omeprazole right along with her ibuprofen to protect her stomach, the doctor said, but no one told her that this stomach protector was quietly, invisibly taking away things her heart desperately needed. Here's how PPIs work. They block the production of stomach acid. Less acid means less irritation in your digestive tract. You feel better, but stomach acid isn't just for digestion. It's the key that unlocks absorption of critical nutrients, magnesium, vitamin B12, iron, calcium, vitamin D. Your body needs enough stomach acid to absorb these. Take away the acid, you take away the key, and the door stays locked. The nutrients don't get in. Magnesium is the one that worries me the most. Magnesium is the stabilizer of your heart's electrical system. Your heartbeat's rhythm depends on it. People over 60 are already more likely to be low on magnesium. Long-term PPI use makes that gap much, much worse. Some research shows that using these medications for more than a year can lower your blood magnesium level by more than half. Low magnesium means your heart's electrical signals get scrambled. You get irregular heartbeats, arrhythmias, in serious cases, ventricular arrhythmias, which can be fatal. For the 2 years before she died, she kept saying, "My heart feels funny sometimes. It flutters." She went for tests. Her EKG looked basically normal. No one checked her magnesium level. No one thought about the omeprazole. And there's another problem that many doctors still overlook when they're writing prescriptions. PPIs can interfere with how your liver activates clopidogrel. That's Plavix, a common blood thinner for people with heart disease or after a stent. So imagine this: you've had a heart scare. Your doctor puts you on Plavix to prevent a clot. That's a life-saving medication. But if you're also on omeprazole, which millions of people are, the Plavix may not activate properly. You think you're protected, but in reality, it's almost like you're not taking it at all. She was put on clopidogrel after a bout of chest pain. She kept taking her omeprazole. She'd been on it for 4 years. Nobody ever checked whether those two drugs were safe together. I had a patient once, I'll never forget him. He came to see me because he'd been having heart palpitations for 3 years. He'd seen 7 or 8 different doctors. Had every heart test you can imagine. Everything came back normal. He was frustrated. He was scared. He thought he was going crazy. I sat down with him and said, "Let's go through your medication list one by one." He pulled out a bottle of omeprazole. "This one," he said, "I've been taking it for 3 years. My GI doctor said it protects my stomach." We checked his magnesium level. It was very low. We made a plan. We did not stop the PPI suddenly because stopping too fast causes a massive acid rebound and feels terrible. Gradual reduction over several weeks. We added magnesium glycinate and a good form of vitamin B12 called methylcobalamin. 1 month later, his palpitations were gone. 3 years of suffering gone in 4 weeks. So if you're taking a PPI right now, here's what you can do. Do not stop it suddenly. Instead, talk to your doctor about slowly tapering down over 2 to 4 weeks. Meanwhile, try simple things like ginger tea or peppermint tea. Many of my patients find that these help with reflux symptoms more gently and longer than a pill. And remember, for many people, reflux isn't about too much acid. It's about diet, cut back on fried foods, dairy, processed foods. You might be surprised. Number 4, beta blockers. Blood pressure is high. Take a pill. That seems completely normal, right? Nothing to talk about. But what if I told you that in certain situations, that very blood pressure pill can actually put your heart in a different kind of danger? Beta blockers, medications like metoprolol, bisoprolol, atenolol. If you've had heart problems, you know these names. They work by slowing your heart rate and lowering the force of each beat. That drops your blood pressure right after a heart attack or with certain types of heart failure. They are absolutely important life-saving tools. I'm not denying that, but I've seen too many people who had a heart event years ago and they're still on the same beta blocker. No one ever reevaluated, no one ever asked, "Do you still need this?" For someone over 60, your resting heart rate is already slower than when you were young. If you add a beta blocker and push it even lower, you reduce blood flow to the brain. This is why so many older adults fall when they get up to use the bathroom at night. They stand up, feel dizzy, and down they go. Hip fracture, head bleed. Sometimes they never recover. In geriatrics, we have a name for this: orthostatic hypotension. And beta blockers are one of the most common causes. Here's something else many doctors know but rarely tell patients. Beta blockers can hide the early warning signs of low blood sugar. Normally, if your blood sugar drops too low, your body sends clear signals: shaky, sweaty, heart pounding. That's your body yelling, "Eat something now." But beta blockers mute those signals. You don't feel the danger. The low blood sugar keeps going. For an older adult who also takes diabetes medication, that combination can cause them to quietly lose consciousness without any warning. In the weeks before she died, she had several episodes of dizziness when she stood up at night. She grabbed the wall. She didn't fall. She thought, "I'm just not sleeping well." She didn't mention it to her doctor that morning. She got up, took her pills, walked into the kitchen. Her body was already under so much hidden stress from all these medications together. I remember another patient, 70 years old. He kept passing out. His family thought he had a brain problem. He went to multiple specialists, had MRIs, EEGs, everything. I put a 24-hour heart monitor on him. His nighttime heart rate was dropping below 40 beats per minute. Why? Because he was on a beta blocker and also a stomach PPI that slowed down how his liver cleared the beta blocker. The two together doubled the effect. We adjusted his medications, and he never passed out again. So if you or a family member takes a beta blocker, here's what I want you to do. 1. Check your resting heart rate regularly, not just your blood pressure. If your resting heart rate is consistently below 55, have an honest conversation with your doctor about the dose. 2. Pay attention to how you feel when you get up at night. Dizziness is not just part of aging. That's a signal. 3. If you also take diabetes medication, make sure your doctor knows. Ask them to evaluate the safety of that combination. 4. Ask about checking your potassium and magnesium levels. These minerals are the foundation of your heart's electrical system. Beta blocker users are more prone to low levels. And please never suddenly stop a beta blocker. The withdrawal can cause a dangerous rebound of high blood pressure and chest pain. Any changes must be done slowly with your doctor's help. Number 5. Sleep aids. This one you don't even need a prescription for. Some you can buy at the grocery store or online, and this is the one so many older adults depend on the most. I've been a doctor for over 10 years. I've seen many kinds of suffering, but there's one that's hard for others to see. It's an older person lying in bed. Their body is exhausted, but their eyes won't close. The clock says 1 a.m., 2 a.m. The house is dark. Their mind won't stop spinning. I truly understand that pain. I really do. So when a doctor prescribes a sleeping pill and that patient finally sleeps, I get the relief. I get why people hold on to that prescription. But today, I have to tell you something many people have taken for years and never been told: benzodiazepines like diazepam, alprazolam, lorazepam, and Z drugs like zolpidem, Ambien. Within 2 to 4 weeks of regular use, your body starts to become dependent. This is not about willpower, this is brain chemistry. These drugs change the density of GABA receptors in your brain. Your brain basically rewires itself to need the pill to feel calm or sleepy. If you stop, your brain rebounds. The anxiety and insomnia come back worse than before. So you keep taking it. Sometimes the dose goes up. That is not your fault, but you have the right to know. In her case, her husband passed away. She started having trouble sleeping. Her doctor gave her a prescription for a sleep aid saying, use this short term to get through this difficult time. A year and a half later, that bottle was still on her nightstand. No one had reevaluated. No one asked, do you still need this? The night before she died, she slept deeply, unusually deeply. Sleeping pills can make your breathing more shallow and slow during the night. For an older adult who already has mild sleep apnea, and many do without knowing it, this is a quiet, invisible strain on your body. By the next morning, her body had no reserve left to handle the cascade of all those medications together. I had a patient who sat in my office and said, I'll never forget his words, "Doctor, I know sleeping pills are bad for me, but I really truly cannot do this anymore." I didn't lecture him because that would have been useless. I said, okay, let's find another path. We made an 8-week plan. We lowered his dose every 2 weeks, very slowly. Never stop these medications suddenly. Seizures are a real risk. We added magnesium glycinate at bedtime. We practiced a simple breathing exercise called 4-7-8. Breathe in for 4 seconds, hold for 7, breathe out for 8. Repeat 4 times. We changed his light exposure. 1 hour before bed, dim lights, no phone. A warm yellow lamp instead of harsh overhead light. He also tried some herbal things, chamomile tea, passion flower tea. I don't know if it was the herbs or the familiar routine of making tea. Sometimes those two things aren't that different. 2 months later, he didn't need the pill anymore. He said to me, "Doctor, the sleep I have now is real sleep before." I was just knocked out. He was exactly right. Sleep shouldn't be forced. It should be a place you can naturally arrive. If you or someone you love takes a sleep aid, I'm only going to ask one thing. Remember this, even if you've taken it for years, do not stop suddenly on your own. The withdrawal can be severe. Work with your doctor to make a slow step-down plan. It can be done. It just takes time and patience and someone who understands. So those are the 5 I've put them in front of you one by one, not to scare you, but so you can see them clearly. Now I want to give you an overall way to think about all of this. After more than 10 years of doing this work, I see the same thing over and over for so many older adults. The problem isn't that they're not taking enough medication. The problem is that their bodies are missing the most basic fundamental raw materials: coctin, magnesium, vitamin B12, vitamin D omega-3 fatty acids. These aren't exotic wellness concepts. They are the basic building blocks. Your heart, your nerves, your immune system need to work properly. The trouble is, after age 60, your ability to absorb these nutrients is about half or even less of what it was when you were 30. And when you're also taking some of the medications I just described, your body uses up these nutrients even faster and loses them even quicker. That's the hidden black hole, the reason so many older people feel exhausted, foggy, weak, or have a pounding heart. The root is often not a new disease, it's a lack of basic supplies. I looked for a long time for a solution that could help my patients fill that gap without adding more pills. I found a nutritional formula designed specifically for older adults. It puts these key nutrients together in the right forms and the right doses, forms that are easier for an older body to absorb. It's not a drug, it doesn't treat a disease, but it gives your body back some of the raw materials it lost. If you're curious about it, the link is below. You can look, you can read, you can decide. I'm just putting the option in front of you, but here's the bigger picture, your action plan. 1, make a complete list. Every single medication you take, prescription, over the counter, vitamins, supplements, the occasional ibuprofen, everything. Then take that list to your doctor, not to argue, not to fight, but to sit down together and re-examine each medication. I had a patient in my clinic who did exactly that. Her doctor looked at her list and took her off 2 medications she no longer needed. She told me later, I feel like I just put down a heavy suitcase I'd been carrying for years. 2, ask these 4 questions about every medication. Why do I need this medication? How long do I need to take it? Does it interact with my other medications? Is there a more natural approach I could try first? A good doctor will take these questions seriously, and if they won't, you have every right to get a second opinion. 3, ask to check a few lab tests that aren't routine. Serum, magnesium, coctin level, vitamin B12, vitamin D. These are not usually included in a standard annual physical. You have to ask for them. 4, make sure one doctor, ideally your primary care doctor, sees the whole picture. Specialists focus on their organ. That's their job, but you are not a collection of separate body parts. You are one person, and that person deserves someone who looks at everything together. 5, never forget that lifestyle is the cheapest, safest prescription on the planet. That morning Tai Chi, it's not just movement, it's activating your heart at a low, healthy level, pushing your circulation, calming your nervous system for the entire day. The foods your grandmother ate, garlic, ginger, black fungus, fatty fish, dark leafy greens, people have been eating these for thousands of years, not because they're trendy, because they work. There's an ancient saying in medicine, the highest skill is to prevent illness before it starts. And the person who holds that skill first and foremost is you. Every time I think about that patient, the retired teacher, I don't think about the morning she collapsed. The light was still soft. She was doing her Tai Chi, focused, peaceful. She genuinely believed she was taking good care of herself, and she was trying so hard, but no one ever helped her put all her medications together on one table and look at them as a whole. No one ever asked her, with all of these together, is your body still able to carry this? That is the real reason I made this video, not to make you panic, not to make you distrust doctors, but to tell you that you have a right to know what you put in your mouth every day, what it does inside your body, and whether there are better choices. I can only see so many people in my office, but this video can travel further. If what I just said reminds you of someone you love, a parent, a spouse, a neighbor, someone who takes medications every day and just assumes it's all fine, please pass this along to them. Not because I need the views, but because one person, just by watching this, might decide to have that one conversation with their doctor, and that one conversation could change everything. Tell me in the comments, which of these 5 medications do you or a family member take, and how long have you been taking it? I read as many as I can, and I respond when I'm able, because health isn't just one person's job. It's something we do together. Take care of yourself. And remember, asking questions is never wrong.